Have you started seeing changes in your skin, maybe the tightness, some sagging, some drooping? Once you cross the age of 20, you do start seeing some changes, but maybe you don't really register that these changes have happened. After 30, you start seeing more changes, and those gradually become permanent. So no matter how much exercise you do, how great your diet is, you just feel like there's no improvement in your skin or the laxity, or it's just looking dull. I'm Dr. Anika Goel, Chief Consultant Dermatologist and Hair Transplant Surgeon at Soul Derma Clinic, New Delhi, and I'm going to help you through this. Let's talk about skin tightening of face. The first thing you need to understand is that it is not just your skin that's sagging or the skin that needs to be tightened. Sagging and changes in the skin are happening at every level. They start down from your bones to the muscles, to the fat, the ligaments, and then further the skin and the dermis. Now, we have to start from the bottom up. As we're aging, our bones start to become thinner, brittle, so that bony structure and support starts to get lost. The next is the muscles and ligaments. These start to get weaker, and that's what leads to a drooping appearance of the face because the support is no longer there. The third is the loss of fat. So we don't have fat in the places we want it. You start losing fat around the eyes and other parts of the face and even body, and you start to look a little hollow and gaunt. The next is the dermis. You start to lose hyaluronic acid as well as collagen, which is responsible for hydration and tightness of the skin. So what are the things we can do to combat this? You have to treat every layer individually, and some treatments also give you a more holistic approach. When we talk about tightening the skin, you can start with energy-based devices like a high-intensity focused ultrasound or HIFU device. This is for tightening up the fascia, which basically acts like a hammock in your face and pulls everything up. It also helps to contour the fat as well as to produce collagen, and that's exactly what we need for tightening. This can be done as early as your 20s. The second thing you can think about is something called MnRF, or Microneedling Radio Frequency. This procedure works on contouring the fat as well as tightening the skin. The RF heat and energy produced will help to overall produce collagen and tighten the skin. After this, when you talk about volume loss under the eyes, in the face, then you talk about a filler. Dermal fillers are composed of hyaluronic acid commonly, and they're used to contour the face as well as lift up the face and support the ligaments. There's a misconception that if you get dermal fillers, your face will look bloated or big. That's not true. Sometimes we use the filler just to anchor the ligaments and support the face. So for example, if you have hollow eyes and a sunken cheek, if you give support on the lateral part of your face, it automatically looks lifted and better. The next is thread lifting. Threads are used for collagen production as well as lifting up the face without any surgery involved. It's an OPD procedure and it gives long-lasting results. A lot of times people feel scared that these procedures may not be safe or they may have some side effects. The procedures are relatively safe when done under the guidance of an experienced dermatologist or someone that has good experience and is medically qualified to perform these procedures. They are medical treatments, so they should be done under guidance, I repeat. Now, when we talk about the aftercare, a lot of times you're worried that is there downtime, you may have some major events, you may be very social, you may be busy with work, so you can't afford to have any redness, lumps, bumps, and so forth. The good news is there are treatments for everyone. When you talk about HIFU, there's usually no downtime, you have mild tenderness at the most. The next is when you talk about threads and fillers, you should not have any major event for at least 1 to 2 weeks, just in case of any bruising. And of course, when you talk about MnRF, there can be some redness, little mesh-like appearance over the face, so at least 3 to 5 days should be there where you can kind of cover up with some makeup, but you have no major event going on. The cost can range anywhere from $3,000 to $30,000 and even up to $1 lakh depending on the treatment chosen. Are we combining treatments or are we doing a single treatment? And this will depend on the level of sagging and the requirement. If you're looking for skin tightening procedures, I would say go under the needle rather than going under the blade. This is good for prevention as well as treatment. Keep in mind we also have treatment options for tightening that don't even involve any needles or pain. If you're looking for any kind of skin tightening procedures, contact your dermatologist today. If you found this video helpful, you can share it with your friends and family, like and subscribe to our channel, and comment for any questions that you may have down below, and I'll get back to all of them.